let me write this. Okay, chapter 25 is the gastrointestinal diseases, and you've already looked at some of the gastrointestinal organisms because I know each of you has already done the lab, right? So the enteric microorganisms you're already very familiar with, so I can go through that at a pretty brisk pace so we can get to the review. So, structures and functions of the digestive system, those of you in A&P2 are already familiar with. Those of you in A&P1, I will do just a quick overview. Essentially, when we talk about the gastrointestinal system, remember that's a closed system that runs from the superior aspect of our body to the caudal aspect of our body. It's a closed tube system that's full of microorganisms. The highest amount of microorganisms is actually in the large bowel, in the large intestine, but there are microorganisms beginning in our mouth, in our esophagus, in our stomach, small bowel, large bowel, even out through the rectum. There's a significant amount of microorganisms there, predominantly bacterial microorganisms that normally exist there, referred to as normal flora or normal microbiota. But remember, this is a heavily contaminated system. Now, our body is sterile. Everything under our skin, all the way inside our body, to the point of the gastrointestinal tract is sterile. Urine, sterile or non-sterile? Sterile. Urine sterile. There's no bacteria in urine. You don't have to wash your hands when you leave the bathroom. No, I'm just kidding. Joking. That's a guy thing. But urine is sterile. So sorry, but urine is sterile. So there's no bacteria in urine. When there's bacteria in urine, you have a urinary tract infection, and we treat you with antibiotics. Okay. So everything in our body is sterile, with the exception of the closed system of the gastrointestinal tract. Even in our lungs to a certain point are sterile. Now, the upper respiratory passageway, where the mucociliary border is located at, down to about the point of about the second portion of the bronchial tubes, where we go from the mainstem bronchus to the right and left mainstem bronchus to the bronchioles, then it becomes sterile. Bacteria, if it gets down into the lungs, you get a pulmonary infection referred to as a pneumonia. We have to treat that with antibiotics. There should be no microorganisms down at the point of the alveoli. Okay, so we essentially have a sterile system, with the exception of the gastrointestinal system. So perforating injuries to the gastrointestinal system can lead to significant disease. A gunshot wound to the abdomen that perforates the stomach, that perforates the bowels, allow the microorganisms that are inside the bowel to leak out into the rest of the system and cause a very intense infection referred to as peritonitis. You get a ruptured appendix. Again, the appendix comes off a portion of the bowel, referred to as the cecum. There's an appendix that comes off, a little finger-like projection that's hollow, that can get inflamed, rupture, and allows what's inside the gastrointestinal tract to leak out into the sterile peritoneal cavity. A rupture of the stomach from a gastric ulcer. A person has a bleeding ulcer. Ulceration migrates through all the walls of the stomach and eventually perforates. It leaks out the gastrointestinal contents, those contents that are in the stomach, then leak out into the system. So anything that gets out of the GI system, the alimentary canal, and gets into the rest of the system would cause a significant infection. So, as the slide says, first group of organs, essentially a tube-like gastrointestinal tract, alimentary canal, the mouth, the pharynx or the throat, the esophagus, the food tube, and then the stomach, small intestines, large intestines would be the GI tract. There are a number of accessory organs. Accessory organ structures such as the teeth, salivary glands, liver, gallbladder, and pancreas. Now, gallbladder and pancreas are outside of the true alimentary tract or the true GI tract, still a part of the digestive system, but this is why they may not be sterile. Because in the gastrointestinal system, those of you in A&P2 already know this, but there are ducts that connect the pancreas to the bowel. There are ducts that connect the gallbladder to the bowel. There are also ducts that connect the liver to the bile. And so an intense bacterial infection can potentially migrate up those walls, up those ducts, and infect the pancreas and the liver as well. But typically when we think of the liver and the pancreas, they're outside that realm of bacterial organisms, because typically those organs don't contain, are not suspect to the bacteria that we see in the true alimentary tract. So keep that in mind. Now we'll see some viruses will attack these organs. Hepatitis, for example, hepatitis A, B, and C can attack the liver, and sometimes the infection comes through the gastrointestinal system, but it's not because it migrates up those ducts. It gets in the gastrointestinal system, and then it gets into the bloodstream, and then it infects those organs. Mumps are an example that can attack not only the salivary glands, but also can attack the pancreas as well. And then again, like I said, hepatitis, you can get hepatitis A by eating bad shellfish, but it doesn't migrate up the duct. It doesn't migrate up the duct. And that wasn't a hand signal for me. Excuse me, those of you listening to the media. That wasn't a hand signal for me, was it?
Oh,
No. So you're seeing everything okay. I thought you weren't seeing the slide or something. I'm sorry. Okay, let me continue. So, for example, hepatitis A, you can eat bad shellfish and get a hepatitis A infection, but it's not because the hepatitis A virus migrates up the ducts, the cystic duct, the hepatic duct, and gets into the liver. It's because it gets into the bloodstream. So I just want to differentiate that. So, except for the teeth, the tongue, these lie outside the GI tract, produce secretions released in the gastrointestinal tract. The action of the secretion, what antibody is in the secretions? IG, sounds like A, maybe A, IgA. The actions of the secretions in the bile, pancreatic enzyme, saliva, in the stomach, and the intestinal tract convert ingested foods into an end product of digestion. That IgA, I'm almost sure that's on the test. By the time the liquefied food leaves the small intestines and the feces and absorbs, and the absorption of sugar, fatty acids, amino acids produced in the digestive tract is almost complete. Absorption, remember, nope, AMP2 people would know this. I can't do this on AMP1, sorry. Okay, absorption of food products takes place in the small bowel. Now, digestion takes place once you take food into the mouth. Chew it up. Digestion is taking place. There are enzymes in the mouth that start to react, amylase, lipase. You swallow the food, the amylase, lipase is still working, gets into the stomach, gastric juices and enzymes will react there. Still no absorption. Absorption doesn't take place until the food leaves the stomach and gets into the small intestines, and that's where the absorption of food. But look at this system. The foods that we eat are not sterile. The foods that we eat are loaded with bacteria. Okay? But when we swallow those foods and it gets into our GI tract, the digestive enzymes in the GI tract will kill those bacteria. Or the pH, highly acidic in the stomach, will kill those microorganisms. And so then when the food gets into the small bowel, even if it's bacteria left, our system is amazing enough to be able to absorb only the molecules we need, carbohydrates, proteins, and lipids, leaves the bacteria inside the GI tract, passes on into the large bowel. In the large bowel, water is absorbed in the large intestines, primary role of the large bowel to absorb the water, still leaves the bacteria in the GI tract. We absorb all the water we need, boom, we get rid of all the residue out of the anus, and it still leaves the system, the body itself, sterile, but the bacteria remain in the GI tract. So it's an amazing system what goes on in the gastrointestinal tract. Water, vitamins, nutrients are absorbed in the large intestine. In the mouth, salivary saliva contains millions of bacteria. That's what's wrong. Contains millions of bacteria. The stomach and small intestines have relatively few because of the acidity that's there. The large intestines has an enormous amount of bacteria. Most of the bacteria in the GI tract, the predominant, is in the large bowel. That's a test question. Among the antimicrobial defenses of the intestinal tract, Paneth cells, millions of which line the intestinal tract, they phagocytize bacteria. They also produce antibacterial proteins called defensins, easy to remember, defensins, and antibacterial enzymes, lysozymes. And lysozymes, we see that a lot in secretions as well. Lysozymes will destroy bacteria. So, How are diseases transmitted? Well, transmitted through food and water. There is what's referred to as a fecal-oral cycle that has to be broken. That means that doesn't mean that we're eating feces. That's not what it means. What it means is that the water supply or the food supply may get contaminated by raw sewage. The organisms that we eat or the animals that we eat may drink raw sewage. Shellfish, for example. There may be a water supply that we don't realize is communicating with sewage, open sewage, and so then the water supply gets contaminated with the sewage. That's what's referred to as the fecal-oral route. Now, yes, poor hygiene, poor cleanliness, and yes, you can get contaminated literally with feces, touch your face, touch your mouth, and actually contaminate yourself directly with stool. That certainly is possible. But when we refer to the fecal-oral route, we typically mean that somehow sewage has then contaminated the food supply. One of the big outbreaks of hepatitis A related to food products that were imported from, can't remember, I don't want to blame a country, but it was imported from South America somewhere. And they were using water to wash the vegetables and fruit before they actually came to the market. Well, the water that was being used was contaminated with sewage. And so even though the water looked clean, people were getting, it was a heavy outbreak of hepatitis A, and it was related to the water that was used to wash the vegetables. So, and that would be considered a fecal-oral route, but it's a very indirect way. Just an example. This picture, I should have showed that earlier. This is the gastrointestinal tract, just as we've discussed already. Large number of organisms in the gastrointestinal tract, large number in the large intestine. Most of them predominate there. Greater than 300 species in the mouth, Bacteroides, E. coli, Enterobacter, Klebsiella, Lactobacillus, and Proteus. Now, let me make 2 points here. Number one, Bacteroides. If you know, Bacteroides exist in the gastrointestinal tract, and a person comes in the hospital with a pneumonia, you obtain a sputum culture from that person, and it's a gram-negative organism, and it's identified as Bacteroides, but it's in the lungs. Where did it come from? The person's an alcoholic. The person passed out. He vomited. He threw up and swallowed it down in his lungs, and he's got Bacteroides pneumonia. So if you see gram-negative organisms, E. coli pneumonia, Enterobacter pneumonia, sometimes Klebsiella, though Klebsiella can just come from the mouth. But if you see those types of pneumonias, gram-negative pneumonias, are typically aspiration pneumonias. We know that because those organisms are typically in the gastrointestinal tract, in the stomach. Person passed out, threw up, aspirated, swallowed it down in their lungs, and developed Bacteroides. Proteus infections in the urinary tract. Where did it come from? Now, most urinary tract infections occur in females over males because of the proximity between the rectum and the urethral opening in the female. And so females who wipe from back to front, that's right. So the mechanism of wiping is from front to back after you urinate or after you have a bowel movement. Why? Because you don't want to contaminate the urethra with the microorganisms that are in the bowel. And so if you see a Proteus urinary tract infection, typically you know that the person got the infection from the bowel tract. And so you treat accordingly. So that's why identification of the microorganisms are so important. E. coli and other organisms can exist in the body anyway. Sometimes we can't always make that correlation between fecal contamination with other organ systems, or I should say GI contaminations with other organ systems. But these organisms normally exist in the GI tract. They do not normally exist in the lungs. They do not normally exist in the urinary bladder. Why? Because urine is sterile. You don't have to wash your hands when you leave. I'm sorry. Get off that. Okay. Dental caries. You also see bacteria in the mouth. Dental caries are caused by microorganisms. Hard surface of the teeth accumulate masses. Let's see. I'm sorry, exam 3 is ready to go, by the way. That's what that message was. But dental caries typically are caused by microorganisms. There are hard surfaces on the teeth, the enamel, that actually will allow the accumulation of microorganisms, especially along the gingival areas. This is called dental plaque, important factor in the development of dental cavities. Most important carcinogenic, I'm sorry, that's a bad typo there. A carie-causing organism is referred to as Streptococcus mutans. I don't know if that made the cut on the test questions. We'll see in a little bit. But Streptococcus mutans, very common organism causing dental caries, cariogenic type of organisms that can lead to dental infections. There are the development of vaccines for Streptococcus mutans that will basically, will hope to stop, I won't say eradicate all dental infections because some other organisms can cause it as well. But it is a prevalent infection that we see in dental caries. Some antimicrobials protection provided by lysosomes in the saliva, tissue exudates in the cervical fluids. Sorry about the typo. Old plaque deposits called dental calculi or tartar can also develop. And then once the enamel has been penetrated, other bacteria can be involved in decay as well and can enter into the deeper layers of the teeth. Those of you who haven't studied A&P2 yet, you learn the anatomy of the tooth, but this dentum and pulp, which is the soft center areas of the tooth, bacteria can invade into those areas as well. Just an electron microscopy of Streptococcus mutan out of your book. The path of decay for tooth, also seen in your book. Periodontal disease typically shows where you can avoid tooth decay. Later you can lose the teeth itself, or the periodontal area, the area surrounding the teeth, can be involved in the infection as well. As these gums recede with age, it will be exposed to what's called cementum, and the microorganism then gets into the lining, the tissue lining around it, leading to gingivitis, further migrates into the deeper recesses of the tooth, getting, again, you can see as it invades into the pulp area as well. Periodontal disease, periodontitis can then result. Most periodontal disease, such as gingivitis infections, infection of the gingiva or the gums, a condition characterized by bleeding of the gums when you brush your teeth. Chronic forms of gingivitis, referred to as periodontitis, the gums are inflamed, they bleed, pus can form in pockets that surround the teeth, can lose teeth, it can involve the destruction of the deeper areas or the recessed areas where the teeth will actually have connection with the mandible or the maxillary bones, so it can actually erode and get into the teeth as well. Acute necrotizing ulcerative gingivitis, bad case of periodontal disease, also referred to as trench mouth. Boy, that's got to be a bad one. Trench mouth, acute necrotizing ulcerative gingivitis, serious mouth infection. Prevotella intermediate basically is the organism that's causing that. I didn't ask you a test question on that. Intoxication is a disease resulting in the ingestion of a toxin performed in a food in microbial growth. Infection in these diseases result in microbial growth in the tissue of the host, severe diarrhea accompanied by blood and mucus termed as dysentery, and a number of microorganisms can lead to that. Another term that you may hear used commonly clinically as well is referred to as gastroenteritis. Gastroenteritis, very common, commonly seen in clinical settings, generally means inflammation in the stomach or the intestinal mucosa. Now, does not have to be related to a bacterial infection. You can get a chemically induced gastroenteritis from taking non-steroidal anti-inflammatories. Now, typically that's just gastritis, but it can also get into the bowel tract as well. Sometimes the NSAIDs are not dissolved in the stomach, non-steroidal anti-inflammatories. They get further in the gastrointestinal tract, such as in the small bowel, and it can lead to a gastroenteritis. So it's inflammation, doesn't necessarily mean infection. However, most cases of gastroenteritis are related to an intestinal infection. The therapy of choice in gastroenteritis, and even in most of the major cases of gastrointestinal infections, whether that's from Salmonella, Shigella, the Vibrio diseases that you've already looked at, most of the most effective therapy is rehydration. You have to rehydrate the individual because they will lose a significant amount of fluid from nausea and vomiting and diarrhea. I don't know if anybody's ever had gastroenteritis, a severe case where you had a combination of intractable nausea and vomiting and intractable diarrhea, and you basically climbed in the bathtub and turned the shower on and hoped that you would die anytime in the next 5 minutes because you feel so bad. And it's very severe. The abdominal cramping is awful. The nausea and vomiting is awful. And those are typically caused by a bacterial infection. But the key here is not necessarily to kill the bacteria. You don't want to stop the diarrhea. You want to get that out of your system. The longer it's in your stomach, the longer you're going to be sick. So a combination of, and what we did overseas a lot, you don't see it as popular in the United States, but in developing countries, you give activated charcoal, you give mag citrate, and you give antibiotic chaser because you want to get it out of your system. Activated charcoal absorbs the toxin from the bacteria, so you want that in the system. The mag citrate cleans out your system. It's a cathartic. It just cleans everything out. And then you give the antibiotic afterwards because the toxins are what's causing the symptoms. The bacteria is secreting the toxin, but you got to get it all out. And if you don't, and if you take Lamodal or you take kaopectate and you stop the diarrhea, all you've done is kept a bacterial infection inside your system. So you have to be careful with the use of the antidiarrheals, especially if it's caused from a bacterial infection, because you can actually prolong the symptoms. Okay? So just keep those things in mind. But the important therapy is rehydration, fluids and electrolytes. I think that's a test question. It may be on the lab, or it may be on the lab, but it's a test question. Symptoms usually include diarrhea, gastroenteritis, dysentery, bloody, mucousy stool, dysentery, treated with fluids and electrolyte replacement. I'll say that again. Treated with fluid and electrolyte replacement. Infection caused by the growth of pathogens. Incubation period 12 hours to 2 weeks. 12 hours to 2 weeks, depending on what the microorganism is. Intoxication by the ingestion of toxins. Bacteria produce toxins. Symptoms appear 1 to 48 hours if you ingest the toxin. In other words, the bacteria already has produced the toxin. You ingest the bacteria with the active toxin. Symptoms don't take long. That's why with Clostridium, if you ingest Clostridium at a picnic, or Salmonella, for example, but Clostridium especially because it has a very potent toxin, you ingest that, boom, you get sick right away. You know, the wedding is still going on and you're in the emergency room throwing up. I mean, it happens pretty quickly. And that's why it's always very easy to identify what the source was when you get a group of people that come in. You know, everybody was at the fair and, you know, boom, now you got 100 people in emergency rooms all over the city with GI complaints. After you've seen your first 4 or 5, then you call the next emergency room and you ask them, say, hey, are you guys seeing a lot of because the last 4 people that came from the fair, and they all ate the corn dogs. So the corn dogs must be contaminated. And that's kind of how epidemiology works. But that's another topic for another day. Staphylococcal enterotoxicosis. Staphylococcus aureus produces an exotoxin, which because of the effect on the digestive system is called a enterotoxin. Causes nausea, vomiting, diarrhea 1 to 6 hours after ingestion. Now, serological type A enterotoxin, you just need to know enterotoxin is responsible for most of these cases. Enterotoxin is heat resistant and withstands boiling for 30 minutes. So if I ask you a question that says to rid a person of the potential of enterotoxin and you boil it at a low temperature for 5 minutes, typically will kill most of the toxins, the answer is wrong. You got to boil this stuff for about 30 minutes, if not longer, because it's heat resistance. At least 30 minutes. It withstands boiling for 30 minutes, so you got to boil it for a long period of time. Coagulase positive, I know we've talked about coag negative organisms, but coag positive Staphylococcus produces coagulase, which is an enzyme that coagulates blood plasma and usually is associated with the production of toxin. So you want to check the staph You want to see if the staph organism is coag positive. If it's coag positive, you know it produces the enzyme, and so you know it can cause a problem. Coag negative organisms we don't worry too much about. Coag positive are the ones that we are significantly affected by. Staphylococcus is resistant to drying, radiation, and osmotic pressures. So salting of the meat, as they did back in the day of yore, works sometimes, but some organisms are not affected by the osmotic pressure that salting can cause. Radiation therapy we thought to be the catch-all for most organisms, but as you can see, it can be resistant to radiation, and then the drying effects as well. Custard, cream pies, hams, foods that are a high instance of this kind of poisoning, largely because the presence of the sugar concentration that we see are the curing agents that are used, which suppress non-staphylococcal competition, but staph itself can flourish in these environments. Foods can be contaminated with staph on fingers and or from skin lesions. Erysipelas and what am I thinking about with kids? Impetigo, thank you, is strep, but you can get also a comorbid staphylococcal infection with that as well. Those conditions, those lesions leak, they get on the fingertips, they get on the hands. Child comes in, has impetigo, or play with another child with impetigo. You know, kids don't wash their hands that well. Then they come in and they use the same utensils, they eat the same food, or they say, hi mommy, hi daddy, or whatever, and you get contaminated with the staph from the fingers as well. So it may have to incubate for a period of time, but it can lead to problems as well. Pathogenic Staphylococcus ferments and mannitol, which again, I didn't ask you anything about that as well. It also can produce hemolysis, gives a particular type of reaction on an agar plate, a blood agar plate. You see a zone of clearing where it will hemolyze the red blood cells that are on the agar plate, and it helps to identify it. Remember, coag positive, they have coagulase positive, they form yellow colonies as well. The source of contamination can sometimes be determined by typing or phage typing, the particular type of bacteria, and that's just an illustration out of your book that's important. Now I know you've already done shigellosis from your lab, but just quickly, Shigella, organism that also can cause dysentery, bacillary dysentery. Sony is one of the major organisms, the most common one we see in the United States, causes a relatively mild disease, whereas dysentery is not common in the United States and causes a much more severe disease. It's also known as Shiga. Toxin is known as the Shiga toxin. And this is just, again, another illustration out of your book showing that Shiga can cause inflammation and bleeding. That's where the term dysentery comes from, mucus and or blood that we see in the stools itself. Now, Salmonella, again, in your lab, Salmonella, not assigned to a species, differentiated by 100 of different types of serovars. There are just a lot of different types of Salmonella out there. Really prevalent in the poultry industry. Really prevalent in the poultry industry. That's a test question. Considered to be pathogenic in a number of different types of serovars. Salmonellosis results in the ingestion of organisms and growth of cells in the intestinal tract. And I know you've already been tested on this on the previous lab, but you'll be tested on it again. Why? Because it's a very common gastrointestinal infection, and it's important to be able to recognize it in the clinical settings. Again, there's a tremendous amount of chicken that's consumed in our country, and also there are a significant amount of poultry producers in our country as well, and poultry producing plants, and so because of that, Salmonella is a very prevalent type of organism. Symptoms include moderate fever, nausea, diarrhea, low mortality rate. A lot of these organisms, especially in the United States, have a low mortality rate. Now, in developing countries, that's not necessarily the case. Many of the dysentery types, the Vibrio diseases, the GI infections can cause death, especially in children. Why? Because of dehydration. You lose a tremendous amount of fluid, and children will dehydrate and die because of that. So again, in the United States, though, specifically in the United States, we talk about Salmonella, the mortality rate is very low. Common inhabitants of the gastrointestinal tract in many animals, Poultry industry, egg products, eggs come out of the chicken has salmonella. Now the surface of the egg has salmonella as well. Not usually inside the egg, but outside the egg. But if you don't wash the egg and you crack the egg and it's on your hand, you cook the egg, but the salmonella is still on your hand, then you eat the egg and you contaminate the food somehow. Maybe you had a biscuit, maybe you had some toast or whatever, you touched it with your hands, you got salmonella. And that's how it happens. Salmonella, common inhabitant in the gastrointestinal tract. Salmonella typhi, very virulent serovirus of salmonella, causes typhoid fever, leads to salmonellosis. Now, most people put, I had typhoid fever, but I said, what's the disease that leads to from salmonella? How was the question worded? You probably remember better than I do. But I gave credit for like food poisoning. If you put food poisoning, that's correct. It does. It leads to food poisoning. But and don't leave a question blank if you have to write something in there. Let me know that at least you gave it a shot. But anyway, incubation usually about 2 weeks. Typical symptoms are high fever, malaise, diarrhea appears only late in the disease, second or third week. Mortality rate typically very low. Septic shock and/or septic shock because of the fever that's associated with the disease and the dissemination of disease throughout the system. Salmonella enterica typhi. Bacteria spreads through body by phagocytes. 1 to 3% recovered patients become carriers harboring salmonella in the gallbladder. Very nice little tidbit there. Salmonella typhi is very virulent serovirus. Salmonella can cause typhoid fever. Incubation about 2 weeks. Typical symptoms, high fever, general malaise. Diarrhea appears only late in the disease, second or third week. Severe cases may be, or you may see a perforation in the intestinal wall, which really can cause some major problems, leads to peritonitis and other bad things. Typhoid fever, occasionally characteristics of a disease in chronic carrier, continue to spread the disease in feces after recovery. Antimicrobial therapy such as third generation cephalosporin can be effective in treatment. We'll go over antibiotic therapy next week or the week after. Vibrio diseases, and I know again this is a part of your lab. Vibrio cholera, cause of cholera, spread by fecal oral route. Organisms produce enterotoxin. Cholera toxin, intestines cause rapid loss of bodily fluids, electrolytes, and violent vomiting. Whew. Treatment, any form of cholera based mainly on replacement of lost fluids, electrolytes. Antibiotics are not very effective. Untreated, death rate is as high as 50%, 1% when it's properly treated. So properly treatment is fluid and electrolytes, fluid and electrolytes, fluid and electrolytes. Vibrio cholera serotypes produce cholera toxin. Toxin causes host cells to secrete chloride, bicarb, and water. Cholera, distinct diseases resulting in cholera toxin. These are the different types of serotypes that you see in cholera. Some can cause a gastroenteritis, which you're already familiar with, inflammation in the stomach, inflammation in the intestinal system itself. Later organisms are indigenous and most specific in Gulf coastal waters. Most likely to be invasive, you see symptoms such as bloody stools and fever. Vibrio perihemolyticus, this causes gastroenteritis such as cholera, but usually not as severe. Most common gastroenteritis is in Japan. Organisms requirement for sodium, growth in a medium to be able to grow in a lab. Most contain a 2 to 4% sodium chloride type of mixture. Non-cholera vibrios, also there are other serotypes with that as well, and they're